first up, we have Ms. Hanna Pitzer. She received her bachelor's degree in economics and finance from Ball State University in the spring of 2002. Throughout her undergraduate career, Hanna has been interested in mental health research. She plans on continuing to explore this area of research as she pursues her PhD in economics at Emory University in the fall. Hanna?
Hi, thank you. Okay, I'll just leave it there. So like she said, I just graduated from Ball State University in May. And so I'm going to be presenting on what I did my honors thesis on, which is the effects of mental health parity laws on mental health. So first, my motivation for it is that 20% of Americans struggle with mental illness, and those that do have a lower quality of life than others. So it's really important to know what impacts the changes in mental health and how we can improve mental health care. Additionally, mental health care and the effects on mental health haven't been researched very much. It's very slim, and that's partially due to data. We don't have the data for it, but also we haven't researched it. And so I wanted to make sure that I researched something that is important to me. And so finally, there are new methods of finding the treatment effect of different policies on different outcomes. And so the research that's already been done needs to be checked again because we now have these new methods. And so we need to see if those results hold up. So first, I'm going to explain what mental health parity laws are. So basically, a parity law tells insurance companies that they need to offer mental health care at parity or at the same amount of coverage as physical health care. And so there's different levels of that. Some state laws will require anywhere to offer and include mental health care at parity. Some will say if you choose to include mental health care, then it has to be at parity. So there are different ones that it can be. And in 1996, the Federal Mental Health Parity Act of 1996 went into effect, and it said that health insurance plans, including mental health benefits, so they're choosing to include mental health benefits already, must have the same annual and lifetime limits for mental health care as they did for physical health care. And so that was a federal law. Before that law went into effect, only 11 states had some sort of mental health care insurance law in effect. But since then, and by 2002, 45 states had already passed legislation on this. So after that law, a lot of states started to pick up and start enacting their own parity laws that were more strict than that law. So what about Indiana specifically? In 2010, Indiana passed a law that I refer to in my thesis as a mandate if offered law. So basically, it's very similar, but a little more strict than the 1996 MHPA. And it says that those that offer mental health coverage, it has to be at parity with the physical health coverage. So that's what Indiana has, and we haven't changed our parity laws since then. However, in 2015, we did expand the Healthy Indiana Plan, which then offered coverage to additional Hoosiers who did not have coverage previously. And the health coverage that they received did have mental health care at parity with physical health care. And so firstly, I looked at what previous literature said on the subject. So I looked at the effects of what people found on the effects of usage of healthcare when parity laws are enacted. And so first, Harris, Carpenter, and Bow in 2006, they found that parity laws succeeded in both increasing access to care and increasing usage of mental health care when they were enacted among those with mild mental health illnesses. Bow and Sturm in 2004 They found no significant or consistent effects on parity legislation, however. Additionally, Pakula and Sturm in 2000, they also found that state parity legislation is not associated with a significant increase in any measures of mental health service utilization. So there's a little bit of mixed effects that we found. Next, I went into looking at actual mental health outcomes. So there's been previous literature on the effects of parity laws on suicide rates. So again, this is a mixed bag of results. Click and Markowitz in 2006 found that mental health mandates were not effective in reducing suicide rates. However, Lang in 2011 found that mental health parities did decrease the suicide rates significantly. So the data that I used is from the Behavioral Risk Factor Surveillance System, which is an annual survey of US residents, and it asks questions about health and behaviors. And so I used the data from 1993 to 2009. And my dependent variable that I looked at was poor mental health days per month. So that was a question in the survey that asked the number of days in the past month that the respondent had mental health, including stress, depression, and problems with emotions that had not been good. My mental health care legislation data I collected it from other papers that had already researched the parity laws in different states. So I compiled data from Harris, Carpenter, and Bowe in 2006 and Lang in 2011. And so the methods that I used to determine the treatment effect of these parity laws on poor mental health days was just accepted methods that are for determining treatment effect. So I used difference in difference methods, event studies, Goodman-Bacon decomposition, and Abraham's son. And so previous literature had only done the first two. And so I added to the literature by using Goodman-Bacon decomposition, which decomposes the treatment effect into those that are treated early and those that are treated later. And so what I found is I found no significant effects that parity laws improve mental health or reduce poor mental health days. And so here's just one of my event studies. And as you can see, on the x-axis is the time from treatment. So the negatives are before the law went into effect and the positives are after the law went into effect. So the law goes into effect at time 0. And as you can see, there's not a drop at time 0. There's a drop before, but we wouldn't expect people to be using more mental health care or feeling better about mental health before the law is enacted. That doesn't really make sense in this case. So we can conclude that there isn't really an impact, as there also isn't a difference in the slope afterwards. And so I'm also happy to explain more in detail if anybody has any questions after about my results or any of the other tests that I did. And so in conclusion, I can't conclude that parity laws significantly impact mental health. However, there are several reasons that might be, and so there's still a lot of room for future research. So first of all, as you guys might be wondering about already, I did use a fairly subjective measure for mental health. And so a proxy that is more objective might be better, for example, suicide rates, just because that's not something that if I'm the respondent, am deciding in the moment. Additionally, I stopped my data collection at 2009. However, the Mental Health Parity and Addiction Act of 2008 went into effect in 2010. And so that might have an impact if we looked at more later data to see if states then were impacted by that. Additionally, I looked at all respondents of the survey. However, in the future, it might be better to look at just respondents that do have health insurance, because hypothetically, they should be the ones most impacted. However, because there might be increased access to care in general or more practices offering, then it could impact the full community. And additionally, looking at the out-of-pocket cost to patients, because just because insurance covers it, is it still going to be so expensive that it's not worth it to get the care? And so that is what I think needs to be looked at in the future. However, right now, I can't say there are any effects. And so are there any questions? Thank you.